Hello, my name's Andrew Chukwuemeka and I'm a consultant cardiac surgeon. Heater-cooler units are used in open heart surgery to raise and to lower a patient's temperature when they're connected to the heart-lung machine. They are a very important piece of equipment which we use in heart surgery. Unfortunately though, it's the case that these units have recently been linked to a potential risk of serious infection. Mycobacterium chimera infection has recently been identified as a potential problem worldwide. In the United Kingdom, we estimate that those patients who've had heart valve surgery have a risk of about 1 in 5,000 of having acquired this infection at the time of surgery. For other open heart operations, the risk is even lower. If you're in the at-risk group, that is, you've had open heart surgery or a heart transplant or a lung transplant, but you're feeling well, then there's nothing that you need to do now. What you should do is, when you next see your GP, you should make them aware that you have had heart surgery and make sure that that's documented in your medical records. There's no test which can predict whether or not you're going to get this infection, so there's nothing you need to do now if you're feeling well. The symptoms of Mycobacterium chimera infection are unfortunately not specific, and they can take a long time to develop, up to 5 years we believe. If you're not feeling well, our advice is that you should see your GP in the usual way, and if you are found to have this infection, then a specialist heart and infection team will come together to decide what the best treatment would be for you. The risk of infection with Mycobacterium chimera at the time of heart surgery is low, and we put in extra measures to reduce that risk even further, but it can't be eliminated entirely. If you're about to have heart surgery, then your doctor should discuss this in detail with you. It is important to remember though that the risk of getting this infection is very much lower than the risk of not going ahead with your heart surgery in most cases. The NHS is working very hard to reduce the risk of Mycobacterium chimera infection after heart surgery. Detailed guidance was issued to all hospitals where heart surgery is carried out in November 2015. No cases of infection have been identified in patients who've had surgery since November 2015. If you've had heart valve surgery since January 2013, the hospital where you had the surgery will be in touch with you and with your GP to provide you with more information about the risks of this infection. But it's important, again, to realise that if you're feeling well, there's nothing that you need to do now.